Good morning. It is sadly only just getting light here in the UK and Scotland, but it is such a pleasure to be able to do this In Conversation with Live series again. And I have the most brilliant clinician joining me today. We'll have her with us in just a moment. She's based in Australia, so that's why we're doing the live so early this morning, because it's sort of early evening in Australia, so it was really sort of the best time. But I will save this on the grid for anyone who isn't able to join us live. And then hopefully it'll be available for anyone to watch back in case they can't watch it right at this moment. So I think I have her here, get her to join me. Hopefully everything will work. Let's try that again. Hello.
Hello, how are you?
I'm doing really well. I was about to say good morning, but it's good evening for you.
It is over here, and good morning to you.
Thank you. So I just want to jump right in because there's so many things that I want to talk to you about.
hmm
To start, just in case there's anyone watching who's not aware of you, can you just introduce yourself very briefly?
Sure. So my name is Yumiko Kadota. I was born in Japan, and I've lived around the world, including in the UK. I've spent a couple of years in Philippines as a baby, grew up most of my life in Singapore. I was in London for fifth form, and then since I was 15, I've been here in Australia. And I'm a doctor like you. I went to medical school here in Sydney, and I wanted to do plastic and reconstructive surgery. So I was working in the public hospital system here for about 8 years before I eventually resigned from being overworked and burnt out. And it's that was about 3 years ago now, and it has taken pretty much all that time to recover from quite bad mental illness. But I'm finally well, and I've been back in the clinical environment for the past year.
That's great. I'm so glad to hear that you're well again. But I want to sort of go back and just talk about your whole journey through medicine. So
Mm.
starting right at the beginning, when did you know you wanted to be a doctor, and when did you know you wanted specifically to pursue surgery?
Oh, I think it was probably right towards the end of high school. I wasn't one of those people who grew up as a child wanting to be a doctor. I've always had a creative streak in me. So I think when I was 3, I wanted to be a ballerina. I've had all sorts of other dreams other than medicine, and I really enjoyed music as well. So I had lots of different interests. But in year 12, that's when so in the final year of high school, that's when I decided I wanted to do medicine. And I pretty much knew surgery was going to be my thing as soon as I started med school. Like I loved anatomy, and the medical school here integrates the junior medical students into the clinical environment straight away. So we were in hospitals from first year, which I don't know if do you do that over there as well, or is that more for the senior
Um,
medical students?
yeah, so I did graduate entry medicine, and yeah, it was more sort of classroom learning the first 2 years with a
Mm,
little bit of hospital creeping in the second year, but we weren't sort of fully in the hospitals till the
right.
fourth year.
So for us, I was an undergraduate, and it was a 6 year course, and we were into the clinical environment straight away, hospital placement. So I got a taste of what surgery would be like from the very beginning, and I just got such a buzz from being in the operating theatre. I found it very exciting. I've always been kind of a manual learner, a mechanical learner, so I loved that aspect of using my hands to work and to heal people. So I knew pretty much straight away that surgery was what I was, yeah, that what I wanted to do.
I can really relate to that. That buzz, as a medical student that you get when you first walk into theater and how
Mm,
exciting surgery is. So then once you started working as a doctor, you were a brilliant surgeon. I think that's really fair to say. Worked really, really hard. From reading your book, I could tell, you're always sort of one of the top of the class, top intern, like really excelled in everything. And then we had this sort of crash and burn that you've written about so eloquently and articulately. And the situation you describe sort of in your book with
Mm,
how hard you were working, in a way, you know, I think it's pretty damning in terms of the way the hospital treated you.
mm,
You know, working hundreds of hours of overtime, all those consecutive on calls, which were 24-hour on calls. And I think, you know, there's really no way that the hospital could claim ignorance of your working environment, because the
mm,
issue was raised so many times. I think you mentioned in your book, you know, your head of department had said, "Oh, you're too damn good. We don't want to lose you. Like, we need to
mm.
remedy the situation." Your GP had written to them because of the toll it was taking on your physical and mental health.
Yeah.
And then this viral blog post kind of happened. So could you talk us through how that came about? Because you wrote it a few months after you'd already left the hospital. Is that
That's
right?
right. Yeah.
Yeah.
So yeah, as you described, there's always a process of escalation. If you've got an issue at work, you've always got a direct supervisor. There's I guess a chain of command that you go up, and I had pretty much exhausted all the options at that stage, and so I just felt like there was no other choice for me but to leave because I just physically couldn't keep going with the work at the time. And so I would have resigned in June of 2018. And I didn't write about it for the long time because I wasn't ready to. Well, first of all, I was absolutely exhausted and I was panicking. I was thinking, oh my goodness, I have to go and find a job again. I'm unemployed. This has ruined my career. And I was panicking and I was still sitting lots of different job interviews to try and find my backup plan. But eventually I kind of succumbed to mental illness around October of that year. So that would have been, yeah, a few months after I had resigned. I became so unwell that I ended up being admitted as an inpatient for 6 weeks, mainly with insomnia. That was my definitely my worst symptom of having severe depression. I just couldn't sleep, and I think that's probably a symptom related to being on call all the time. And I think when your brain is just switched on all the time, it's very hard to sleep. It's hard enough to sleep as it is sometimes, but when your brain is always on standby, it's very, very difficult. And it actually took several years for me to be able to sleep again. It took a very long time, but I spent 6 weeks in hospital. And during that time was when I decided to set up a blog. I was allowed to bring a laptop to the hospital, and I knew that I've always enjoyed creative writing. So I knew that that would be something nice for me to do while I was in hospital. And I had learnt surprisingly some IT skills while I was a plastics registrar. I was not expecting to do that, but I was working for a plastic surgeon a couple of years prior, and they got me to do all sorts of things that are not really related to my job. And one of the things was to maintain their website and write a couple of blog posts for them. And at the time, obviously at the time I thought they were making a mockery of my role as a medical practitioner, making me do IT and admin work. I thought, why am I doing this? But it worked out okay because without that, I would not have known how to set up a website, a blog, and know anything about SEOs. So that for anyone who's not heard of SEO before, it's search engine optimization. So there are a few things you can do to make your content come up higher up on searches. And so I had gained those skills unexpectedly when I was working at that practice, and I definitely utilized them to make my blog post seen because I had just gone through such a harrowing experience, and I knew that I wasn't the only one, and I wanted to share it. So after I got discharged from hospital, I started thinking about what had happened and thinking about writing about it. I actually didn't write the blog post itself until Boxing Day that year, and then I made it public in February, which is the start of the clinical year here in Australia. So I was quite deliberate. I was quite planned in when I wanted to post it publicly, and I did it the weekend before the start of the clinical year, almost like maybe not a warning, but just to reach out to all of the young registrars about to start the clinical year to say, hey, I know it's going to be hard. This is what's happened. And if it happens to you, I want you to be seen. So I posted it the day before the clinical year was about to start, and it just ended up getting spread on Twitter. I wasn't even on Twitter at the time. So I didn't realize that it was getting retweeted so many times, and eventually ended up in the news here. So it it definitely, even though I did deliberately use SEOs and things that I wanted people to read it, it definitely went wider than I thought it was going to.
Were you surprised at how sort of widely spread it became and how quickly it sort of spread everywhere?
I was so surprised when I got contacted by the main newspaper here, the Sydney Morning Herald. I was actually frightened because I was scared of the media.
Yeah.
We're not media trained as doctors. I guess we know science, but we don't really know anything else. I didn't know how to present myself. I'd never done any sort of media. So I I didn't know whether I wanted to talk to the journalist. I was worried about how I would be portrayed, but
Mm.
I was very lucky. I spoke to a lovely journalist who was very sympathetic and understanding of what had happened, and she made sure that I was comfortable with everything that she was writing, and I felt that I could trust her in that process. So she wrote a very nice article about it, and I had heard from a few different people that she was a very well respected journalist who writes about the medical industry, and she's someone who's quite passionate about junior doctor issues. So even though I was a bit reluctant to talk to the media at the time, I felt confident talking to her, and then from there, it went to the television, it went to a few different media channels, so it then kind of expanded a bit more again from there.
Like, to me, it's not surprising that it, was sort of as widely spread as it was, because I think clearly it resonated with a lot of doctors,
Mm,
and the experience you described, it's something that we don't talk about a lot of times. And you call that post, the ugly side of surgery, right?
mm,
Um,
yeah.
and I do feel like, especially as young women, who want to go into surgery early on in our careers when we're medical students, you do have people sort of say, oh yeah, you can do it, like, don't worry, this, we need more women to go into surgery, it's
Mm,
going to be great, we're encouraging you to go in. And then people don't really mention, yeah, there's a reason why there's still these, big disparities in the number of women and women of color in surgery. And like, I remember for me, a big moment is I had a plastics registrar who I really looked up to, who was absolutely brilliant. And we sort of went to different hospitals, and for a year, like, didn't keep closely in touch, but she sort of was aware that I was getting ready to
mm,
apply to my core surgical training and all of that. And she sent me a message and she said, Emmaline, I just need to tell you I'm leaving surgery, which shocked me because she was,
yeah.
surgery was her love and her passion, and she was a great surgeon. And she said, I'm not trying to discourage you from surgery because I know it's what you want, but I just want to explain to you why I'm leaving and maybe tell you some
Mm,
things that people aren't going to say. So I think your article was that same sort of thing,
mm,
passing the message along. There are things that you need to be aware of if you're going to be in surgery, and our sort of inability a lot of times as doctors to ever talk about these
mm,
things, it doesn't help anyone.
yeah. I'm curious to know, what did that registrar say to you?
So for her, I think the turning point was when she got pregnant.
Mm,
And she said the bullying and the constant comments about her
mm,
pregnancy, and how, if even the tiniest thing happened, if she were 5 minutes late for a ward round because she had this
mm,
massive 2.5 hour commute across London, the
mm.
consultant surgeon would say, we're making a lot of allowances and exceptions for you, so the least you could do is show up on time, that sort of thing.
Right. Yeah.
And her
It,
schedule was so grueling that it
mm.
ended up affecting her pregnancy and her health. And she
Oh
had
no. Yeah.
sort of a threatened miscarriage that she sort of put
Mm.
down to operating overnight on her feet. And, when she
Yeah.
wasn't supposed to be doing that. And she sort of had this moment where she thought, what? My health and the health of my future son is more important.
Yeah,
And I just
definitely.
need to step away.
It's so hard for women in surgery. Even if you're single, it's hard enough. I can't even
Yeah.
imagine what it would have been like as a pregnant women. And I think that's such a great example of how there are so many physiological changes to the body with stress. When we think about stress, we think about the feeling of stress, the feeling of anxiety related to stress. But what we don't often talk about are the physical symptoms, like things do change in the body with stress. There's the adrenaline and the cortisol, and we do have kind of metabolic changes and changes to the gut function. And it's, yeah, you actually can physically get so ill from chronic stress. And I, for me, it was my bowel. It affected my bowel. I just, yeah, I just kind of feel icky hearing that story because I can totally relate to feeling physically unwell from overworking. But you also raise a good point about what we have to say to younger women who want to enter surgery. It's such an awkward thing, isn't it? You have to balance being supportive and optimistic for all these young women with great ambition while also being truthful and realistic about the road ahead. I mean, I still encourage women to do surgery because I think surgery is amazing. It's such a great opportunity to do good things. Surgery itself is very interesting. It can be a very rewarding career, but at the same time, I think it would be unfair for me to say, "Oh, you'll be fine." Everything's going to be fine when I know that that's not the case. And even in the 3 years since I've left the public health system, I just know that things really haven't changed that much. I still hear stories about bullying. And even after I've left, even in the private system now, I've seen a lot of bullying and misogyny. The other day I even posted about a woman surgeon calling me a gimp, like, and for anyone who doesn't know that word, it means you're a sexual slave. And it was in relation to me being an assistant surgeon to a male surgeon. So to sexualize women and to say something offensive like that, I just thought that I had kind of moved on from that sort of environment, but I think it just shows that that kind of toxicity and misogyny is just everywhere in the medical profession. So unfortunately, it can be hard to escape sometimes. And it's they love to tell women who are outspoken to just be quiet, but I think that unless we talk about it, people aren't going to change the way that they speak to others. And so even though sometimes my mouth does get me into trouble, I do think that it's important to stand up for things that are important to you. And for me, like, I'm such a staunch feminist, so if I see misogyny, I will call it out. I'll call it in first. I'll always speak to the person involved before calling out. But I think that unless you talk about it, it's very difficult to change culture, because I think cultural change starts with small conversations.
Absolutely.
It's not grand gestures. It's about educating one person at a time to say, "Hey, that wasn't cool, and this is why," and just to make it, you don't have to make it uncomfortable. You can just talk about it in an open way, but it can be very awkward. But it's just something you just have to practice, I think.
And along those lines of being really outspoken, so I wanted to ask you a bit about the reaction to that blog post, because I
Mm,
think you were very sort of careful in the original article. You weren't naming the hospital or anything like
mm,
that. But I think a little bit down the line, I saw a tweet that you did where I don't know if it was one of your old bosses directly or one of the consultants that work at the hospital, sent
yeah.
you a message sort of saying, you need to take that down. And you were
Like,
like,
you're not the boss of me anymore. It's a bit too late. It's the,
but
what do you call it? It's a Streisand effect. When someone tells you to be quiet, you get louder. So,
yeah, exactly. So in
yeah.
terms of like the reaction from other,
Mm.
surgeons, clinicians, what was it like? Was it overwhelmingly sort of positive from the juniors, or were you getting more pushback from maybe older
Mm.
consultant surgeons?
Well, it's interesting because not a lot of people will say things to my face. I guess maybe they're worried that I'll go to the media again. But look, I know that not everyone was a fan of the blog post. Of course, it's not. It's always going to polarize people when you write something that's controversial. So I expect as much, backlash as much as support. And there was a lot of support from other young women surgeons because they have gone through the same thing. But of course, there are people who, behind your back will say, well, she exaggerated it, or she's just bitter that she didn't make it, or, there'll be all sorts of reasons for people to try and cut you down. But I think overall, I think young women felt seen by that article because it describes their experience too. And to your point earlier about why it kind of went widespread is I think it's very rare for people to put their face and name out there when it's
Yeah.
something like this because there's so much risk. And if you come out and speak about, um, you know, poor conditions in your industry, you're pretty much blacklisted. It'll be very
Yeah.
difficult to find a job in the public system again after, exposing behaviors like that, I guess. So I knew that there was a risk, but
Yeah.
at that point I was just so over it that I didn't care.
But
I'd
that,
already
that
left.
just
I
feeds
felt like I had nothing to lose.
but it just feeds into the toxicity, doesn't it? That
Oh
you
yeah.
feel like you have to, if you want a career in surgery, I need to keep my head down, just take it,
Mm,
whatever they throw at me, however horrible it is, like just keep my mouth shut, get through it. And that's awful.
mm,
No one should have to put up with that. But
yeah.
they've created the system where it feels like that's the only way that you can succeed is you just have to accept that you're going to have to put up with all this crap. And it
Mm,
shouldn't be like that.
yeah.
And then, so your blog then sort of went on to become the inspiration behind a book called Emotional Female, which I've got my copy with me right here.
Oh, thank
And
you.
it's a brilliant book. Oh, it's amazing. I
Thank
absolutely love
you.
it. And I think I messaged you as soon as I finished it and just like
Yeah.
said thank you. Because again, I think it really spoke to that whole thing of like feeling seen that no one ever really talks about this stuff or admits to it. So having
Mm,
someone like you articulate your experiences so well, put it in a book, put it out there, it actually made a massive difference to me personally, and I know a lot of people
oh,
as
thank
well.
you.
I want to talk about the title of the book because I love the title of the book, but it came from an insult, didn't it?
It did. So the book's called Emotional Female, and I am an emotional person, but that's something that I'm actually proud of. I think that to live life to the fullest, sometimes you have to feel all the emotions, feel all the colors. But it was an insult initially. I had quite a firm word with an emergency registrar about an inappropriate referral in the middle of the night. It was 3 o'clock in the morning for an appointment booking, and so when you're working such long hours, you do need to protect yourself. You do need to kind of, what's the word? Uh, for once, I'm lost for words. Um, you do have to manage your fatigue when you're
Yeah.
working so much. And so I was quite passionate about making sure that registrars who do these 24-hour shifts weren't called in the middle of the night about things that weren't urgent. And so I said it in a polite way initially, but this man didn't like being told things by a woman, and it quickly escalated, and he told me to stop being an emotional female. And that's where I thought of the title for the book. And I guess it made me think about Hillary Clinton being called a nasty woman as well, and just reclaiming it,
Reclaim. Yeah.
Yeah, that's what I wanted to do, just to reclaim it. And it also feeds into some of the themes of the book because I do think that it is important to show your emotions as a professional. I think that there's this idea that as a professional you need to almost be cold. You're not allowed to show
Yeah.
emotions in front of patients. That's what you kind of get told as you progress. But what I have learned over the years is that patients actually just want you to be human.
Yeah.
Patients want you to show empathy and warmth, and they want to know that you actually care about them and you're not just a number on a screen in the ICU or a medical condition. You want to be treated like a whole person. And I think that if you are able to show your emotions as a health professional, it's a lot. Patients, I think, feel more satisfied with their care if you're able to show
Absolutely.
your emotions. And that's something that I wanted to emphasize in the book because I think that you know, it's funny because people say to me, "Oh, you're too nice to be a surgeon," or whatever, and I just think,
I've heard that
well,
before.
actually, we need more of that in surgery. You need
Yeah,
people who are soft. You know, of course, sometimes in situations like a rapidly deteriorating patient, you do need to just be purely clinical and just be commanding of the situation. But I think that there is space for softness and warmth in surgery, and that's something that I definitely wanted to write about.
definitely. And I think, a lot of complaints when they happen with patients, it's down to a communication issue, which
Yeah.
I would say
Mm.
empathy plays a big part in that as well. Because I've seen myself, the way some surgeons sometimes interact with patients, there's a lot
Mm.
of empathy there. Um, and I think I thought you made a really good point as well about the emotional sort of female thing being used as an insult, but saying someone's emotional, it's always a very gendered insult, isn't it?
Mm.
I've had it said
Yeah,
to
men
me.
never get called emotional, do
No, they
they?
don't. If
Yeah.
they're, if a guy's struggling or having a difficult time, no one ever says, "Oh, you're being too emotional." But when I've had moments where I've struggled with burnout or just felt,
Mm.
really anxious or panicked about going into the
Mm.
hospital, which I think, especially after this past year in COVID, is quite a universal feeling with a lot of clinicians.
Oh, I
I've
imagine
been,
so. Yeah.
yeah, and I've been told, "Oh, you need to stop being so emotional about it."
Mm.
And I'm like, is that supposed to be an insult to me that I care about my patients, or that, it's been a difficult year for everyone? But
Yeah,
yeah,
yeah.
men never really get that thrown at them, do they?
And if anything, I want this to help men be able to express their emotions too. Let's just take gender out of it. We should all be emotional in the workplace because we need to humanize healthcare. At some stage, it got taken away, and I think patients really do want to get a sense that you are genuine when you're caring about them. And I think that part of the issue with men not being able to show emotion in the workplace is because there's so much toxic masculinity where they feel like they can't. And that affects men's mental health. It's actually a huge problem here in Australia. We have, lots of very blokey guys, especially in rural communities where there's a very, very high rate of mental illness and suicide. That the highest rate of suicide here would be among young men, particularly in rural communities. And I think part of that is because of the cultural stoicism out there and not being able to show your emotions. So I think that by talking openly about it, and of course it's a feminist book. I am a huge feminist, but I also obviously care about the men in my life as well. And I think it's important for men to be able to show their emotions because it can be very maladaptive if you don't. It's just, mentally, it's just so important to be able to express how you feel.
And I think there are so many things in medicine that are sort of ingrained in the culture that are very maladaptive. So
Mm.
yes, that always sort of not showing any emotion. I think we glamorize overworking a little bit as well. I've
Oh,
been,
definitely.
yeah, I've been guilty of it
Yeah.
myself, where I've had,
Oh,
a conversation with calling me like, "Oh, I just worked like 20 days in a row," almost as like a brag rag, where it's like, actually, that's
yeah.
terrible.
It's not really a
And
competition, is it? But it
no,
feels like it sometimes.
yeah. And also, presenteeism is an issue where if you're feeling unwell or you need a break, there's that guilt or that pressure. People don't take
Mm.
breaks, and then, it ends up
Mm.
leading to a crash and a burn further down the line. Um, I wanted to sort of discuss burnout a bit more
Mm.
with you.
Yeah,
Because
definitely.
again, I think you were beautifully honest about what burnout felt like for you, and sort of the recovery
Hmm.
from burnout, and sort of how long it took you to recover from burnout. Um, and one of the other things that I think I've heard you mention was that therapy was a big part of your
Mm.
recovery. And again, I
Definitely.
think it's something that a lot of doctors, either they're unwilling to admit that they might need therapy or unwilling to engage. And I just wondered if
Mm.
you would sort of talk about, your experiences with therapy a bit.
Ah, definitely. I think I think it's normal to have therapy. I think even if you don't have a mental illness, you should still go to therapy. It's so helpful. You learn a lot about yourself. You learn skills that help you cope with everyday situations. So I definitely want to normalize therapy for everyone, not just people who have mental health illnesses. But you know, I didn't really benefit from the typical kind of therapeutic approach to depression, which would be the cognitive behavioral therapy. For me, I think a huge element of what I went through was traumatic. So I found a type of therapy called DBT very helpful, the dialectical behavioral therapy, which teaches you skills to cope when you're feeling distressed. So I would often get triggered by things, you know, I would feel uncomfortable if I bumped into a doctor or a nurse that I knew or worked with, or I was close to a hospital I'd worked with before, and just kind of coping with the feelings of distress was something that I needed to do with a therapist, and I wouldn't have been able to get better without that. And I mentioned earlier how, you know, I love creative things. So for me, art therapy and music therapy helped me a lot. And I think that while I was an inpatient, it was the art therapy that helped me more than anything else, helped me more than any sort of medications. I know that sometimes a lot of people trash medications, but you know what? If you need medications, then you need them. There's
Yeah.
nothing wrong with taking them, and they are an important part of it. And I have to say that I I tried all sorts of things to sleep, and the only thing that allowed me to finally get my sleep back was a change in antidepressants. And that was towards the end of 2019, I think. So after 18 months of having mental illness, I finally switched to a new medication, after trying a few different ones. And once it kicked in, I slept. And that for me was a really big kind of message that it's a lot of it's neurochemical. You know, the fact that a medication switch can suddenly allow you to sleep again told me that, you know what, there's just chemical things happening in the brain. There's still a lot we don't know about mental illness. Some of it's psychological, and there's so many different modalities to help people recover from mental illness. But a lot of it is biological, a lot of it's
Absolutely.
neurochemical. And so I definitely don't want to downplay the role of medications, because without it, I definitely would still have insomnia. But now I can sleep again, which I am very grateful for. I love my sleep now, and I love that I'm able to sleep. But therapy wise, yes, the DBT, art therapy, and music therapy were all very beneficial. And I also have to mention exercise. You know, a lot of doctors forget that exercise is very therapeutic for all sorts of conditions. It's not just for diabetes and heart disease, it's so important for mental health as well. I had a psychiatrist who recommended um, 3 days of resistance exercise a week, and that I believe that's the current recommendation to help with mental illness. And so I went to see an exercise physiologist, and that was very helpful. That also improved my quality of sleep. And so when I speak to GPs these days, I say, don't forget about the exercise physiologist. Don't forget to involve allied health in kind of the overall holistic care of patients. Sometimes it's easy to just prescribe things or think about the more common methods of treating people, but things like exercise physiology can make a big difference to a lot of different conditions. So I'm definitely a big fan of the EPs out there. I definitely got better with my exercise physiologist, and I have to say that's probably one of the main reasons that I teach BodyPump now, a few days a week. It's more for my mental health than for my physical health. I'm one of those people who needs routine. So
Yeah.
by being given these regular classes to teach, it forces me to do it, because otherwise I might not get up to go and do a class. So um, that, you know what, this kind of leads me into something I wanted to talk to you about,
Yeah.
Emmaline, which is about portfolio careers.
Oh, yeah.
Yes. So tell me about your portfolio career. I've seen all the different things that you do, and I love this topic. So let's chat about that.
Okay. I love this topic too. Yeah. So, for anyone who's watching who doesn't know what a portfolio career is, it just basically means that you have several different strands of income or different jobs that make up your entire career. And I think with the issues around burnout and the stress and the pressure of the NHS at the moment, and I think of many healthcare systems around the world, a lot of people are moving to do something like this. So what I do, obviously medical aesthetics is my main sort of passion and love, and we'll talk about that in a bit because I know you love it as well. So I do medical aesthetics. I'm still involved in the NHS in the emergency department, so I tend to do a couple days a week with that. Under the umbrella of sort of the medical aesthetic stuff, I'm able to do quite a lot of writing, which is nice. So some of it paid, some of it unpaid. But I've always enjoyed writing. I'm very creative like you. So I love that aesthetics allows me to do that. And then I work as an event medic as well. So I am able to go to like professional rugby games and be a doctor there, which is really, really fun. But I think one of the things, I actually did a talk with some medical students last week about portfolio careers. And I think one of the things that I'm really passionate about when it comes to portfolio careers and being able to do different pieces is I think for a lot of people, it makes medicine sort of a sustainable, viable option to continue with. If I'm completely honest, like I've burnt out myself, and it's something that I struggle with. And I find if I do too much of the clinical work, I very easily sort of slip back into that stressed, burnt out mode. And again, particularly this last year with COVID, that sort of was basically all I was doing. But, you know, medicine's an incredible career and profession. There are so many different things that you can do within medicine. And I think when I was sort of at my lowest, what was a bit sad was I'd always wanted to be a doctor and I wanted medicine so much. And like, as you know, it's hard getting through medical school. Like doctors in general, I think are resilient people, really hard workers.
Yeah,
We shouldn't be losing them in the waves that we are losing them. Doctors are fleeing the NHS at the moment.
We've got the same problem in Australia. Doctors and nurses are leaving the workplace because they're all burnt out from COVID.
Exactly. And it's the feeling I just had was like I've worked hard my whole life and spent like my entire young adult life, like all my 20s, like working, training, trying to get to some point in this career that I love. And all I feel right now is trapped in something I hate, in something that's destroying me. It was like the most depressed I've ever felt. And I feel like, and sometimes that does come back a little bit when you're in a very toxic working environment. And it was so sad that the career that I had wanted so badly for so long and worked so hard for was making me feel like that. And so
it's almost like a breakup, isn't it? It's devastating.
Yeah,
it's heartbreaking.
It's so heartbreaking. It's devastating. But I guess one of the things I wanted to emphasize to the medical students is it is possible you might feel like this at some point. I think the reality of this system and the work environment we go into, yes, very likely will feel like this at some point. But I think the beauty of a portfolio career is it gives you that little room to breathe. It gives you a little bit of that versatility. You're able to do quite a few different things. You're still a doctor, you're still practicing medicine. A portfolio career has allowed me to continue to still work for the NHS. I think if I weren't able to step back and focus on other things, I would have had to just leave the NHS completely, which, would have been a shame. Because I moved from the States to the UK because I wanted to work in the NHS. But I am also at the point as well where ideally I want to be able to sort of step away more from the NHS because at the moment it's just not the right thing for me. But I guess what I really wanted to emphasize is like medicine, it still can be a great, fulfilling, wonderful career. And it gives you options. Never feel like you don't have options. Like as a doctor, the skill set you have, the learning you've done, all the work you've put in, like, you can do so much with it. You're not trapped within just this one toxic system. So never feel like that. So that's my little spiel about portfolio careers.
I completely agree with you. I think that a lot of people are afraid to leave toxic environments. And I think part of it is maybe a little bit of imposter syndrome. You think, well, what could I possibly do? Because this is my main thing. If I go elsewhere, what if I don't get hired, or what if I can't do anything else? But we we are privileged, you know, we have had an education. And so when you're in this place of privilege, you do have options. Other people may not have the same options who
Mhm.
haven't had the privilege of an education, but if you have had it, you've got skills and knowledge that are very transferable, surprisingly transferable. And like you said, you know, we both do a bit of writing. It's just great when you can expand and do other things because I think a lot of medical people have lots of hobbies and interests
Yeah.
outside of medicine and perhaps because medical career can be so demanding, you might feel, I think part of burning out is feeling like you don't have time to do other things that you enjoy. And
100%.
I think creative expression is a very important part of life for a lot of people. And so I love that you've got a portfolio career where you can do these other things using, like I always like to use both the left and right side of my brain. So as much as I can be a critical thinker and quite mathematical in some ways, I also have my creative side, and I like that we can do that. And so I actually think it's a generational thing as well. When I
Yeah.
talk to people in their 20s and their 30s, it's something that people want in their lives. They want a bit more balanced. I think that less and less people are doing full-time employment where you're just stuck with one company, 9 to 5, um, and that's it. You do nothing else. I think that that's kind of an older model of working, and now people are feeling more empowered to work for themselves. They're feeling more empowered to do different things so that you don't, and I like the word you used before, that you don't want to feel trapped.
Yeah.
And it's easy to feel trapped when you've only got the one workplace. But I suppose if you've got all these different things that you're doing, it helps you kind of have a bit of release and you know, you don't want to be seeing the same people all the time. It's good to interact with lots of different people in different areas. So you know, obviously when you go into med school, I think both of us wanted to do surgery, and you kind of imagine this kind of very linear pathway of
Yeah.
becoming a surgeon and working in a public hospital and operating, and you think that that's the model that you want to follow. But then it's been surprising how diverse the medical workforce is and how many different things you can do. There's actually a group in Australia called Creative Careers in Medicine, and I sometimes hear from people in that group and the things that they get up to, because there are a lot of creative doctors who like doing artistic things, performing arts, all these other things in their spare time. I so I think that if you're someone who has a lot of different interests, I think portfolio career is definitely a good option.
Yeah. And I really relate to what you said about that mindset, going into medical school and be like, okay, going to be surgery, obviously going to get on
Mm,
this training pathway or this scheme and just sort of go down the line. I've got a very clear path in front of me. And it's a big shift in your mindset to move away from that.
mm,
And the other thing you mentioned about the generational thing, where I do think, like you said, people our
mm,
age in the 20s or 30s, it's more sort of acceptable and understood. I think for me, I had a hard time explaining to my parents what I was doing. And I
yeah,
think the idea of a portfolio career for them
yeah,
didn't, and maybe still doesn't really exist. Like they're not
mm,
quite sure. My parents are great. They're very, very supportive. And obviously they want me to do well and be happy. But
mm,
I don't think it's quite clicked for them that what I'm doing is my career. I think they kind of
yeah,
think, well, this is a little pause before you go on to do what you're actually
mm,
going to do, whatever it is. And I think we touched on this a little bit, but for you, when you were sort of telling your parents, your
mm.
family about, stepping away from surgery, what was their reaction like?
I think they were shocked, but I think they were more disappointed for me
Mm.
rather than them being disappointed because they just knew how invested I was in it. And I was so obsessed. You know, I would bring home these purple Vicryl ties and practice my hand ties on all the handles and things around the house. My house was like covered in purple braids. So I would just bring things like that home to practice. And there was just nothing else I wanted to do. So I think they were just disappointed for me because they knew that there was nothing else that I really truly wanted to do. And I was surprised by how supportive they were because, you know, I'm Japanese and a lot of Asian parents are known to put a lot of pressure on their kids, and a lot of Asian mums get called tiger mums, and
Yeah.
so I kind of thought that they would be a bit more like that, but they weren't. They weren't at all. And I think, as you were saying about your parents as well, I think most parents just want to see their children happy and thriving.
Yeah.
And I don't think my parents quite get what I'm doing now either. I think they probably think I'm a little bit scatterbrained and chaotic doing so many different things. But I've, like, even when I was in medical school, I was always like that. I always had lots of different hobbies. I always had like 5 different jobs and lots of activities going on. So I'm pretty much living life as I would have as a teenager, I think, just doing things that I enjoy and having, a little bit of a mishmash kind of job. But I think that that suits me because I'm one of those people who needs a little bit of variety in what I do.
Yeah, same, definitely. Um, so I wanted to circle back a little bit
Hmm.
because I think one of the things, you talk about is not only being a woman in surgery, but also a woman of color in surgery, and sort of experiences that you had, or in, women of color in medicine in general, and experiences
Mm,
you've had with patients. And I think, especially this past year with COVID,
mm,
there's
mm.
sadly been quite a lot of anti-Asian sentiment. Um,
Yes.
and I've seen it in the hospitals. Like I've always had little microaggressions. I'm sure you can relate to
Mm,
being half Asian. Growing up in the States or here in the UK, I've always been a little bit treated like an other. But I think that's definitely increased with COVID. And I've seen some really nasty interactions in the emergency
mm.
department. And I was just wondering if have you had any experiences around this, related to COVID?
It has amplified because of
Yeah.
COVID. People saying, a Asian colleague of mine was walking home from work and someone just yelled COVID at her from the car. And I remember at the start when masks weren't yet compulsory, I wanted to wear one, but I was afraid to wear one because I thought, I'm Asian, so if I'm wearing a mask, people are going to think that I've got COVID. And I just knew people would be looking at me funny being an Asian during the pandemic. And there's just been a lots more hate crime, graffiti, things like
Yeah.
that. People saying inappropriate things about Asians and bats and all of these kind of things. Like there's always been this trope of Asian people eating animals like cats and dogs and making fun of what we eat. And I think that
Yeah.
it just got even worse with the whole bat thing with the COVID. So that sentiment, I think, unfortunately, it's been here as well, not just in the UK. It's probably the whole world where we've seen a lot
Yeah.
of anti-Asian racism. And I haven't been in the public system, so I don't know what it would have been like for Asian doctors and patients. And maybe, I don't know, did you experience that, patients being hostile towards Asian doctors or?
So luckily, generally my experiences haven't been too bad, but there have been some incidents in the A&E where I worked. So
Mm,
one wasn't directed at me, it was directed at a colleague who was Malaysian. But
mm,
she got shouted at by a patient, like blaming her for COVID and saying, I don't want you near me and I don't want you touching me, which is
right.
absolutely ridiculous. One of
Yeah.
the consultants in my department as well, who's
Mm,
has an Asian background, I think she was sort of verbally, maybe slightly physically, like pushed around, shoved a bit, attacked when she was out jogging, and also sort of had the same sort of sentiments shouted at her.
mm, mm,
So it's quite, disappointing. And actually, one of the other incidents that I remember, I was teaching surgery to medical students as a surgical tutor when COVID initially hit. And we were having this sort of big announcement in terms of final exams, and they were all going to be pushed
mm,
forward because we were anticipating everything's going to close down, lockdown. Let's get our final meds graduated because otherwise it's going to be a huge
mm.
issue. So the students were all sort of gathered and waiting to hear what was going on. And then one of the students just said, oh, well, we should just kick all the Chinese students out and then it'll be fine. And I was like, what is
Oh,
like, you're going to be a doctor
oh
in
my
the future.
goodness.
So this is your
Yeah.
mindset and attitude. You were comfortable articulating that in front of me as I'm half Chinese.
Oh.
And I was absolutely
Wow, I would have been
sad.
dumbfounded by that.
I
Like,
was, and I actually,
wow.
I was so taken aback. I didn't say anything. I just sort of looked at them. He was like, "Oh, I'm so sorry. I was just joking." But
Yeah,
I
there's
just,
so many jokes about international students, and
yeah,
I was an international student too because I came here at 15, and at the time of applying for medical school, I hadn't been here long enough to be local. But I hear these kind of things all the time, like, haha, this uni is not going to have enough funding because we don't have anyone from China coming anymore, and all this kind of
yeah,
stuff in academia as well. So I've noticed it. I've noticed it.
yeah.
Yeah.
And yeah, I think that's one of my biggest regrets is I was just so taken aback at the time. I didn't really call it out as,
It's so hard to say something when you're stunned, right? You just
yeah,
can't
yeah,
find the words when you're in the situation. Sometimes that's why sometimes I like gathering my thoughts and writing. I'm not so good with speaking sometimes because I can't always think off the cuff. So I think I would have struggled in that situation. I would have been just as stunned as you were.
yeah. No, I'm the same. Is I actually, you know, if I give a lecture or a talk or anything, I have to prepare because
Yeah.
I'm not an extemporaneous speaker. But yeah, it's just sad seeing those sort of attitudes become more and more prevalent, and it's almost like COVID's made it more socially acceptable, or it's brought out that ugliness in a lot of people.
It has, and even the Atlanta shootings as well
Oh,
during the pandemic. I mean,
yeah.
that was more to do with the sexualization of Asian women rather than about COVID. But I think that emotions are heightened at the moment. Everybody is
Mhm.
stressed. The effect of lockdown on our mental health. I think we're probably still going to see the effects of that for a while longer. In Sydney, we've just come out of a 4 month lockdown, and Melbourne was in an even longer lockdown, the longest in the world. I think they were in lockdown for over 200 days over the past couple of years. I can't even imagine the impact that would have had on people. And so to layer the racism and all the other issues, and I don't think we even have time to talk about anti-vaxxers. All of these intense things in the last few years that we've had to cope with, I think it probably has added a lot of stress to
Yeah,
people.
absolutely. I'm gonna change gears again. Just there's so many things I wanted to talk about with you, but
I
I'm
know
also
we've only got eight
conscious.
minutes left, Emily. We're gonna get
I
cut
know, I know.
out.
So I just want to talk about medical aesthetics because it's a
Yes,
shared
we're
love.
both doing that.
Yes, and it's sort of I think the main focus of both of our careers at the moment. So for me, medical aesthetics, I sort of learned a bit of it as part of when I was doing plastics, and I really
Yeah.
fell in love with injecting. And I was wondering, was it the same for you? Was it sort of originally sort of part of your toolkit in terms of being a plastic surgeon, and
Mm.
then you know it developed further from there, or how did you first start getting involved in medical aesthetics?
I actually had no interest in it at all. I remember about 6 years ago, I was starting to see all these facial aesthetics through work and working with a facial plastic surgeon, and there was, a bit of talk about me learning to do a bit of injectables, but I just was not interested at all in it. And at the time, I was still quite young, and I thought I wasn't personally interested in, like, now I'm just like, yeah, give me some chin filler. I love my chin filler, but at the time, maybe I had a bit of internalized misogyny. I just wasn't really into it. I didn't really understand it. But now that I'm a little bit older and more mature, I can kind of respect that women do want these treatments. There's a huge demand for it, and I'd rather they come to someone who is going to do a good job. There are so many botch jobs out there. I want to train myself well so that if people do want it, I'm able to offer it in a safe way and also offer my aesthetic eye, because I think that's a very important part of treatment as well. So I don't actively promote it. I don't say you need all of these treatments because nobody needs anything. But if you choose it on your own, then I'd rather you come to someone you can trust, and I want to be that person. I I have started going into it, but it was kind of by accident actually. It happened last year because I was actually working at the university as a lecturer, and I really enjoyed it. I still do. I still love anatomy, but they had to cut all of these lecturers from the
Okay.
university.
Yeah.
And so I was still doing casual lecturing here and there, but there was just no work in it. And so I looked at some ads, and there was this role to be a prescribing doctor for some clinics to prescribe injectables for nurses in clinics. Is it the same situation in the UK, whether you can have nurse injectors, but they still need a doctor to prescribe for them?
Yeah, unless they're a nurse prescribe themselves, but yeah.
Oh, okay, yeah. So over here we need doctors to prescribe for nurse injectors. I kind of accidentally fell into that after someone said, well, what, there's an ad for a prescribing doctor, why don't you do that? And then through that clinic, they ended up teaching me how to inject and doing more injectable things. So, yeah, so even though 6 years ago I was already in the facial aesthetic space, I really only became super interested in it maybe a year or two ago, just out of the situation that I was in with no work in the university sector. So they cut a lot of academics. I mean, I'm still involved now. I still do the occasional lecturing and examining for the university, but there was just no work, and
Yeah.
there was work in injectables, so I kind of fell into it, and it's just kind of gone off since then, and I really enjoy it now. It's nice.
Yeah,
It's so
it's great.
it's so civilized, it's like you have these lovely patients come in, you have a chat, and you do their treatments. I've always like kind of short, quick treatments. I think that's why I used to like hand surgery. Carpal tunnel is just 5-10 minutes. Same with trigger finger surgery. I like small, kind of satisfying procedures and treatments where you can see a result straight away, and
Yeah.
patients are happy. And so I kind of find that that aspect of it can be quite satisfying. So even though I think there is a lot of judgment for what we do, I
Yeah.
think sometimes you just have to block out some of that hate, because it's less about you and more about the person's kind of own judgments and internalized misogyny. You know, I think
Absolutely.
that I remember a medical like a friend of mine was dating a medical student, and he was like, "Oh, that's not what you go to medical school for, to inject Botox into people." And I was just like, "Mate, why don't you finish medical school first and work in the hospital for 8 years, and then you can judge me?" I
Yeah.
think I've done my time now, and I actually really enjoy this, and it's a nice environment to work in.
Yeah.
And you do need skilled doctors providing the
You
service,
do.
because yeah, there is a huge demand out there for it.
And what you said about, I think also the ethics behind it as well. So as a
Yes.
clinician, having that aesthetic eye and actually knowing when it's
Mm,
appropriate to say no to the patient and turn them
yeah.
away, and not create these botched jobs, as you say, or these distortions of the natural facial anatomy that's
Mm,
actually not good for the mental health of the patient.
yeah, there's so
And
much
not,
dysmorphia, and you
yeah,
have to be able to
exactly.
recognize it, and to limit how much you can provide. And I think that's sometimes where things go wrong, where practitioners aren't able to say, hey, I think you've had too much, or I don't think it's appropriate to treat you. Learning how to say no can be difficult, but I think
Yeah.
it's kind of an ethical obligation that we all have to do.
Definitely. And that judgment thing, I think
Mm,
it's been huge for me as well, just in terms of
yeah.
learning to shut it out. And, I hate anyone to try to tell me that this is a waste of my medical degree, because it's not. These are
Mm,
medical procedures that need to be done well. But also, there's another part of me that just wants to be like, why don't you just, because getting to medical school, it's difficult. We've done medical school, we've done the training. What we want to do with the medical degree that we worked hard for is
yeah.
our own business. And like you
It's
said,
like, can
this
you blame us for leaving after, being abused in a horrible system? We've found a way out, and a way to have a balanced career. And I think that not everything, yeah, I think it's because medicine is inherently altruistic. There's an expectation that you do something to save lives and to help other people. And so if it's not like cancer or trauma or something like that, and it's something that's a little bit more elective, cosmetic, people will judge you for that. But I think
yeah,
that yeah, it is hard. There'll always be people who judge what you do, But it
Yeah.
doesn't matter, you know. They used to judge me wanting to do hand surgery, you know, because a lot of hand surgery patients come through the workers' compensation scheme, and that there's good remuneration for that. So sometimes they say hand surgeons do it for the money. So there'll always be people who will judge every single choice in
Yeah.
medicine. So I think you just have to choose what you love, choose what you enjoy, and just own it.
Yeah. And I think, like you said, you know, people associate medicine with all this dramatic life-saving stuff, which it can be sometimes, but
It can be,
sometimes
yeah.
medicine is also life-enhancing. And I think with aesthetics, you can absolutely do that, you know, make a huge difference to someone's life, their confidence, you know, give them a really positive experience. Oh, so I can't believe that hour flew by so quickly.
It has, yeah.
I feel like I still had
My
all these
light
little,
went off.
oh no. I had all these other little things I wanted to talk to you about, but I think we covered a big bulk of everything that we were
We'll
hoping
do
to.
another one soon. We'll do another
Yes.
one. We'll do an
Oh my gosh.
update.
I would love that. Yes,
It
please.
was so fun.
It was
Yeah.
really fun. And thank you so much for, you know, taking the time out of your schedule to spend an hour with me.
Thank you.
Thank you for writing this book. Anyone who's watching who hasn't read it already, you need to go out and read it. And yeah, please just keep in touch. If you're ever in the UK, let me know. And if I'm ever in
Definitely.
Australia, I'll definitely shoot you a message because I'd love to meet you in person one day.
Yeah, that would be good. I feel like we've already become friends through
I
Instagram,
know. I agree.
where all the best friendships happen. So
Yeah,
yeah,
absolutely.
thanks for having me on your show, I guess, on your live. Yeah.
No, thank you. So I'll let you go. I hope you enjoy the rest of your evening.
Thank
I
you.
think I'm
Have a
gonna go
great
get some
day.
brunch.
Oh, lovely. Have a great brunch and
Oh,
have a
thank
good
you.
evening to everyone in Australia.
All right. Take care.
Bye.
Bye.